in the interest of time, let us begin. I want to welcome everyone to this timely conversation about life safety standards throughout the ASC universe that are condensed and rearranged. My name is Marge McFarland. I am an experienced healthcare life safety surveyor. I've been doing life safety surveys since 1998. I come from a hospital world. I've done consulting, and then I've come to the ambulatory world as of 2022. And I find that it is really a great opportunity to share why we need to do all of these really extensive, seemingly random checklists to make sure that our physical environment is safe for our patients 100% of the time. I have great experience in risk control and safety, as well as environmental and public health. My PhD is in safety engineering, and I am an active member of the Wisconsin Healthcare Engineering Society, as well as the American Society of Healthcare Engineers. Next slide, please. What do we want to talk about today? We're going to review CMS's conditions for coverage, right? Conditions of participation are hospital standards. Conditions for coverage are ambulatory surgery standards. And we're going to talk about all those authorities having jurisdiction that survey us on behalf of CMS to say that we are compliant with the CMS standards and we have the right to accept Medicare and Medicaid money. There has been great realignment of the fiscal environment from Joint Commission of the Life Safety and Environmental Care chapters. That is an upcoming adventure that all of you that are Joint Commission will face. I'm going to discuss the physical environmental changes to the AAHC standards of requirements, statements of requirements, and there's other agencies out there that I will discuss to the best of my knowledge. We're going to talk about tips and tools as to how do we transition these documents and our practices, and then we'll have time for Q&A. Please. All right, so the question is, whose rules do we have to follow? And I always like to review these with people to see who has the biggest stick in the game. Okay, whose rules are outstanding no matter what? And the answer is law and regulation. So OSHA standards for bloodborne pathogens, personal protective equipment, respiratory protection, and hazard communication cannot be deviated from. You can have standards that are more strict, but no state, no locality, no agency can have requirements that are less strict. The FDA has rules and regulations for reprocessing single-use devices. The EPA has rules for hazardous waste, and then state, local health department laws for vaccination requirements, reporting of outbreaks, as well as tracking and disposal of biohazardous waste. That is all a state entity rather than an OSHA entity. And then we talk about building codes. Whose codes do we build to? So state, local, and federal building codes, including the FGI Institute, the Facilities Guidelines Institute, talks about required temperature and humidity, pressure, air exchanges, construction planning, design, and commissioning. And those of you who are in the build process are just going like, where do I find this information? And this is where you find it. Okay, so after we have laws and regulations, then we have conditions for coverage. So this was passed by Congress that you need to follow the CMS rules to get Medicare money. And then the deeming authorities were blessed then by Congress, right? Joint Commission, AAHC, Quad A, ACHC, and now as of December 25, DNV, all have CMS approved standards to prove that you have a safe and functional environment. All of these agencies, all survey to the National Fire Protection Agency, NFPA 101, 2012, and NFPA 99, 2012. And the rub comes when states approve NFPA editions newer than 2012. And so there is some logistics in navigating new construction with a newer model, because you have to be sure that at a minimum, it meets the 2012 standards if the 2012 standards are more strict. Then if we don't have a law and we don't have a CMS rule, then we follow manufacturer's instructions for use. And these are evidence-based guidelines and regulations. And I really see CDC as having a say in these, the World Health having a say in these. But when I look at manufacturer's instructions for use, I think about all the sterilizing and equipment processing, as well as testing for ground fault interrupters and sterilizers and equipment. How do I do this? What maintenance is required? And I go back to the IFU. If we still do not have a ruling on something with all of these four categories, then we go to consensus documents. So I'm thinking about the American National Standards for Institutes, the ANSI standards. They have the IWASH standards, because we're really talking about facilities and safety here. And so again, that's where that comes from. And then we've got AAMI and we've got AORN, and AAMI has put out standards for water, has put out standards for cleaning and temperatures and disinfection, and ARN for safety in the OR and patient care and all of those kinds of things. And again, if the AAMI and ARN standards, because there's a water standard out there right now from AAMI, but it has not been adopted by anybody as law. And so it really is only a best practice today. Next slide, please. All right, we're going to start with Joint Commission and then go to the others. And so changes are coming in the Joint Commission standards. And so if somebody on your team has heard of this, what we need to recognize is that the physical environment standard is absorbing all of the life safety and environment of care elements of compliance, all of them. And so a consolidated performance-based approach. And so all of these changes are available online and open to the public. So if you go to, changes in the physical environment, all of the standards are available. The survey activity guide is available. And these are absolutely in effect for hospitals and critical access hospitals as of January 1st, 2026. It is not yet in effect for ambulatory surgery centers, even though all of the documents from November 25 said ASCs had to abide by this as of January 1st. But when I physically wrote the standard interpretation guides at Joint Commission, they said, no, it is not true for ASCs yet, but it is coming, but they couldn't say when. So this is a chance to be heads up as you review your policies. All the testing documents that we are going to discuss need to reflect the new Joint Commission physical environmental numbers rather than EC or LS. And while there does appear to be many fewer elements of performance, all the documents, inspections, and testing requirements of NFPA 101, 99, 2012 editions remain. Okay, so Joint Commission says, oh, you do not need to fill out those weekly checklists anymore. Okay, but I do not know how you're going to manage all the testing documentation if you do not complete the weekly checklists, the monthly checklists, the quarterly checklists, the annual checklists, and keep track of what your vendors are doing. Because we are talking about fire alarm systems, sprinklers and quarterly sprinkler testing, generators, right? Weekly, monthly, semi-annual, annual, triannual generator reports, air pressure relationships, both test and balance annually, as well as positive pressure, negative pressure checks every day, humidity documentation, egress, that's the way you get out, clear egress all the time, storage, fire, emergency lighting, all of those emergency lights on generators and the bug-eye lights need to be tested monthly for 30 seconds, annually for 90 minutes, building separations, and I'm talking about all of the penetrations and the doors and everything that goes with that, protection during construction, all of the interim life safety measures still apply if you are trying to do business in occupied ASCs while construction is happening, medical gases, fire extinguisher checks, drills, OR evacuation, where evacuation is not a Joint Commission standard, but it is in the NFPA 99/2012, Chapter 15 standard that says you will do evacuation of all staff, including doctors and anesthesiologists, annually in all anesthetizing locations. And so I expect to see that in a standard coming to you soon, and then staff training. And so they say you need to do all these things, but you really don't have to keep close track. I don't know how you can do that. Marge's opinion. Next slide, please. This is from the webinar from Joint Commission in 2025, and it is a publicly available webinar. And so thank you, Joint Commission, because what it says is all of the EC, Environment and Care, and Life Safety chapters are all now going to be in the Physical Environment chapter. And so you can see that there's only 5 physical environment chapters. Sections really. And so the first one is safe and adequate environment. O2 talks about hazardous materials and waste. O3 says comply with the life safety code. That's all the building stuff too. Interim life safety measures talk about construction, building and safety facility management, utility systems. That's all about fire alarms and everything else. And then water management is Legionella, and that is the one chapter area that ASCs are not required to do by CMS. CMS has said hospitals, critical access hospitals, and nursing homes must have a Legionella water management plan. But I say to you, if you have showers in locker rooms that are just lurking, that you flush them as often as you flush your eye wash stations, just to be sure the water is not stagnant. That is just Marge's consultative recommendation to you about Legionella. And then imaging safety talks about all of the rules around radiation with badges and equipment and testing and licensing and regulations. Next slide, please. This is the second PowerPoint given to us by Joint Commission. And you can see there's 2 columns of numbers, standard numbering, right? ECO 101, right, is safety, O2 is hazardous materials, and on down the line. All of these are going into these physical environment chapters. Now, when it talks about the NPG, those are the national patient goals. They used to be national patient safety goals. These are requirements of Joint Commission over and above CMS requirements. And they talk about being a high reliable organization. So they have moved all of the documentation about safe environment, because in the middle of the second column where it starts ECO 20601, that's safe environment. Okay, and then 0304 down has to do with ligatures and patient safety and all of those things, and those are all going into national patient goals instead of being in the EC chapter. Next slide, please. All right, here we have all of our LS numbers, right? These are all life safety numbers. Okay, and these are all going in these 2 different PE numbers. And so instead of having a lot of the LSO2 is all ambulatory surgery, ambulatory words, and O3. And so they have a checklist for door inspections. One of those is door inspections. Okay, and now they're just putting it all into a bundled standard, a bundled standard. Okay, all the elements still apply, but the standard looks like you have less to comply with. And in my opinion, that's not really true. Next slide, please. All right, AAAHC has a physical environment checklist. They've always had, that's what that's called, in their handbooks. The handbooks are available to you if you are applying for AAA or if you
Marge, we've lost your audio. Marge, it says you're on mute.
Were it better?
Yeah, you started to cut out and then you completely went away. So if you want to start fresh from this slide here.
From this slide here. All
Yep.
right. AAAHC physical environment checklist has always been included in the manual. The life safety document request list is now included in version 44. So those of you who are due for survey in the rest of 2026 may show up under version 44. Some of you still here in this first quarter may be under 43.1, but the document list is still the document list. Okay, and so what they did was revise and streamline some of the standards, the statements of requirements, to better reflect the conditions for coverage. And what happens is they condensed some of these physical environment categories. They removed redundant and duplicate requirements and essentially have eliminated 50 plus statements of requirements. Especially in the medical gas standard. Because as a life safety surveyor, if you go out for a AAAC life safety survey, there's about 318 questions that need to be answered, and now there's about 270 some that need to be answered because they remove some of the med gas questions that the surveyors have no way to check on. They've moved additional code references and guidance to sections in the handbook, and I find this to be very, very helpful. It's kind of, what does this mean? It'll say, you need to do this, and then under guidance and references, it says, this is what we're talking about. And then it also has the exact code reference in NFPA 101 or 99 or 72 for fire alarm or 25 for sprinklers. And so again, you can go to those code books and see the exact words. What are you expected to interpret, right? The physical environment document checklist is included. It is critical for both Joint Commission and HHC and all the others that all testing documents are completed and maintained and available. You want to review the standards and Medicare conditions for coverage crosswalk in the new 44 book. Joint Commission is also putting out a crosswalk. And then there was really no substantive changes to the standards, either for Joint Commission or for AAAC, because the code is the code. NFPA 101 and 2012 have not changed. NFPA 2012 and NFPA 99 2012 have not changed. We are still surveying to those. So the code hasn't changed, even though the numbers of the statements of requirement may have been re-identified. Next slide, please. Who else accredits ambulatory surgery centers? So as I could not get to the ACHC standards, I saw the Quad A standards, and really what they say is compliance with NFPA 101 and 99 2012. I reached out to ACHC, and if anybody has the list of documents, that would be great to chat about that sometime. But again, you need to have all of those testing documents from that first page, the fire alarms and the sprinklers and the emergency lights. All of that documentation needs to be readily available at time of survey. The breaking news for ambulatory surgery centers is DNV just achieved deemed status in 12 of 25 for the next 4 years. And the standards are available online for free. So I went online for free and I downloaded them. And they very closely follow the wording in the state operation manual, Appendix L. So state operation manuals are written for all entities that take Medicare. It was last updated in 2022. So the question is, what is DNV? And it's De Nordis Veritas. It's a company that really talks about ISO standards. They have a different approach to making a healthcare safe. They do a lot of work with industry where the risks are identified and the processes are so well honed that mistakes don't happen. Next slide, please. All right. How are we going to do this? So if it were me and this was my surgery center and I needed to take a look at what needs to change for 2026, I would review the current list of testing documents that I already have for survey. And some of you may say, well, I really don't have a current list. And so then you go back, Joint Commission has a specific list in their standard, in their survey activity guide. And it talks about frequencies and what they expect, and it has the NFPA numbers in it. Okay, AAAHC has a current list now in version 44 of the testing documents, and so you want to be sure that you have them all. Joint Commission is providing a crosswalk for the ECLS documents to the PE documents to identify which were consolidated and were removed. That is available for hospitals, but it's not quite available for ASCs yet, but we're watching for that, and we know that it will be happening soon. Okay, and the CMS conditions for coverage are going to be included in that crosswalk. What happened is that some accrediting agencies have proposed standards to make you a high reliability organization. Okay, but they didn't closely align with the CMS conditions for coverage. So that while they were best practices, they were not the absolute minimum that needed to be done. Now, I'm in favor of some of these enhanced practices, but people say, what do I really need to do at a minimum to align with CMS? And that is why Joint Commission pared down some of those standards, and AAAC condensed some of those standards so that only surveyable, actionable standards would be in the guideline. And so again, the moment you get your Joint Commission book, the survey details are in the survey planning guide, which is formerly known as the survey activity guide. So right now, for ambulatory surgery centers, you have the survey activity guide with the document list and frequencies from Joint Commission free on the website at this time. The moment that the ECLS documents are transferred into physical environment documents, it will now become the survey planning guide. Okay, that's what they're changing it to. And so the revised documents in your facility need to include the new standard references, and I recommend the NFPA codes on those documents. You want to develop a training plan to ensure all staff responsible for documents are aware of the new documentation numbering system. I mean, if you've been doing this for a while, you know what the number of those standards is. And now it's completely different. It's completely different. So you want to develop, revise, renew the document management system to ensure all documents are completed and readily available for survey. You can decide at this time whether you're going to start with a clean slate and just enter your documents with the new numbers as you go, or if you're just going to massage the system that you have. It depends on how you're doing with your document lists. If it's all paper, I'd start over. If it's online, maybe you can just change the headers. But this is one thing where if you've been doing it for a while and you're going to try to teach somebody new, if you don't have the list, they won't know where to start. Next slide, please. Staff may not know what's required. As I go around and I talk to ambulatory surgery centers and I bring out my list of documents that are required, they look at me like I'm from Mars, and I say, no, I'm from Wisconsin. But they don't know what they don't know. And again, these lists are available in your handbooks. Somebody needs to take the time and compare what you've got against what is required. And the challenge comes where people may not have much facility or life safety experience. Okay, and there has to be someone like Accurate Accreditation that you can reach out to, okay, and ask a question like, what does this mean? Do I really need to do this? Where do I get more information? And Accurate Accreditation can help you with some of those answers. You want to develop a robust training program to familiarize staff with the new numbering systems and ongoing documentation requirements. This, along with the 25 hats that you're already wearing, would be a high priority. Okay, Marge's strong recommendation is continue using the checklist for weekly, monthly, quarterly testing, even though they may not be specifically called out by the new standards. I do not know how you can keep track of what happens, what has to happen if you don't have a weekly checklist. Because right now, the Joint Commission standard says, do all of the generator checks required based on NFPA 110, that's the generator standard, 2010 edition. That's what it says. Okay, but the expectation is that you're still doing the weekly checklists, you're doing the monthly inspections, you're running the generator monthly, you're doing the conductance test on the batteries monthly, you are doing the 30 minutes, right, with the 5-minute cool down if you have a diesel generator. You're doing the annual fuel test. You're doing the 90-minute test if you don't meet the 30% of the nameplate rating. Okay, and then you're doing the 4-hour test every 3 years. Okay, those things are all checklistable to keep track of. Okay, but the standard now says just do everything that you're supposed to do for the generator. And I don't think that is really helpful to us on the ground, especially if something happens to you who are doing these things and someone else has to step in and they don't even know where to start. And so I'm thinking about transition and communication. A more robust documentation program will be needed, and keep commissioning documents handy. I go into accreditation of facilities and they don't have their underground and above ground sprinkler tests. They don't have their fire alarm record of completion. If you look at the standards, these are documents that you need to keep for the life of your building. And these are golden ticket items, I call them, and they just need to be in the survey book and ready to be admired every time a surveyor walks through your place. Ensure a smooth transition, smooth between construction and occupancy. I have seen many gaps in testing where construction was doing this, they commissioned the building. Okay, the ASC took over. And then when I go to ask for 1-year testing, especially of dampers, they go like, what dampers? And I go, the dampers in the firewall. If you have dampers, they need to be tested when installed and 1 year after installation, not 1 year after occupancy. Okay, but the people who are taking over the building don't necessarily know when they were installed at 1 year. They know when they were occupied. Okay, but it's not on anybody's to-do list so that they can get a vendor scheduled so that can be done. Conduct physical environmental tracers. I think that this is the best opportunity for people to learn, not just environment of care rounds, safety rounds, but take your documents and look at the things and have different people possibly do the checklists. I know people are really busy, okay, but it broadens the scope and it's more likely that everything will get done if at least 2 or 3 people can do each of the tasks. Ensure several staff are available to access documents immediately at the beginning of a life safety survey. Especially if they're on the computer. Life safety surveyors, can wait 15 minutes and they can leave. We don't, but they can. And you do not want to have to pay for a new survey if the documents are not readily available. People don't know where things are. And again, if you have a document list, there's no, especially if it's a spreadsheet, electronic spreadsheet, there is no reason not to have a little column that says, this is where it lives. It's in this file. So that people can do it if it's online. If you have documents that you've put online, vendor tests and all of those kinds of things, that's fine. Do not print them for the surveyor. The surveyor should be able to look at them online. But the most important vendor document that you receive needs to be reviewed to find out if there's any deficiencies in that document and signed by a facility representative. I found just looking at documents, a med gas test from 2025, February 2025, there was a serious error and a deficient serious, a serious error on the documents, and they just stapled them and put them in the binder. Nobody's reviewing them to see if everything is complete and if anything needs to be fixed. Where's the work order that shows that the cycle of repair is completed? Um, you only have 30 days to fix some of these things, some of them 60 um, for CMS. These are life safety. They're life safety things, and they impact the safety of your facility. Next slide, please. Okay, we are to Q&A. Let's talk. Please put your questions. I'm sure you have many questions. Please put them in the chat. Marie will read them to me. We will try to manage this. We have plenty of time for questions. This is a lot to digest, especially if you were not aware of some of the changes, especially the Joint Commission changes. That's going to be a very big deal. And just to help, what can we do to help with life safety documents and survey process?